We usually panic when something goes wrong with our heart or head, but we rarely care when it is about our back until sitting becomes painful. So let's talk about perianal abscess in today's episode. Welcome you all to Varta with Dr. Pooja. I'm Ayurveda pediatrician and an educator at Sri Ramchandra Vaidya Ayurvedic Medical College and Hospital, Lucknow. And this series is in association with Aviral Hospital. And we have in conversation with us a wonderful doctor, Dr. Sandeep Mishra, sir. So
Hello.
we welcome
Hello.
you.
Thank you, ma'am.
Jumping straight to our questions as usual. So, what is perianal abscess? Why are people so scared hearing about perianal abscess?
Ma'am, perianal abscess, as the name suggests, it is the abscess around the anal canal. So it may be near the anal canal, or it may be in the fossa around the anal canal. So any abscess forming near the anal canal is known as perianal abscess.
So, how does it develop?
Uh, it may develop due to two sources. One is indigenous, the bacterial source is through the blood,
Okay, sir.
and in another there is from the external source,
Hmm.
like after trauma or any foreign body if embedded over there, then it may cause abscess. The basic thing is that there are glands in the anal canal, in the crypts of the anal canal,
Okay, sir.
and when they get infected, they form the abscess.
So, it's not necessary that it will always be like starting with the infections, it can be a foreign body as well.
Yes, ma'am. If there is any trauma or any other foreign body is there,
Yes,
then
sir.
it may also cause infection, and it may lead to perineal abscess.
Okay, sir. So, what are the early signs which people usually ignore?
Ma'am, there is pain, discomfort in the perineal lesion,
Okay,
and
sir.
when as the uh, abscess progresses,
Yes,
it may
sir.
become throbbing pain,
Hmm.
and there is a body swelling. At that time, one should not ignore and get it treated.
Okay, sir. Since we are in a series of anorectal diseases, we have already spoken about pilonidal sinus, we have spoken about piles, we have spoken about fistula, fissure. So, how is this different? Because bulgy, swelling, pain, it is almost common in all three of them.
Very good question. Ma'am, the pain in the perineal abscess is continuous pain. 24 into 7, it is continuous pain. And the peculiar feature of it is throbbing pain. It is throbbing pain which occurs around the perineal region. And it is associated also with the fever with chills and rigors. So, pain in perineal region associated with chills and rigors, fever is perineal abscess.
Okay, so necessarily there has to be fever,
Yes,
chills,
yes,
and then
yes,
only
ma'am.
we can associate it with perianal abscess, right? So,
Yes, ma'am. Yes, ma'am.
okay, so who are the people who are at higher risk of perianal abscess? Are they diabetics or they are children or someone who's having poor hygiene?
Ma'am, all the three. Mostly diabetics are more associated with perineal abscess.
Okay, sir.
Obesity is also associated,
Okay, sir.
and the people with poor hygiene.
Okay, sir. So all three of them will be affected
Yes, ma'am.
if they don't take good care of themselves.
Sure, sure.
Okay, sir. Can perianal abscess be medicated? Like it can be cured with self medication or with medicines?
Ma'am, it is very scary about perineal abscess that it cannot be treated by self medication, and one should not delay the treatment. Like any other abscess, they are not. He should not wait for the fluctuation sign. जैसे कहीं पे और एब्सेस होता है तो आदमी
Hmm.
सोचता है कि हाँ ये थोड़ा सा मुलायम हो गया अब फूटेगा अब निकलेगा
Hmm.
एब्सेस बस but here you don't have to wait because here the fluctuation sign is very delay and it is delayed sign. So if you wait for that, then the abscess has already damaged more of the area and it is very late.
How about our Google enthusiast patients or ChatGPT enthusiast patients? Should they be concerned when there's a pain at the back and they should come, or they should just refer Google and ChatGPT?
No, ma'am, not at all. As soon as they have pain, they may they may access the Google and Chat GPT, but they should at the same time concern the anorectal surgeon at once.
And I think it's better to Google search a surgeon rather than Google searching the problem, right?
Yes,
So,
yes, ma'am, sure, sure, sure.
okay, sir. So, what are the other modalities that we use for perianal abscess, for treating perianal abscess?
Ma'am, for treating the perineal abscess, as the abscess anywhere is treated by incision and drainage,
Hmm.
so we give a cruciate incision in the area of the abscess,
Hmm.
and after deroofing the abscess, we take out all the pus from the cavity,
Hmm.
and after cleaning the cavity, it is healed by the granulation tissue in the next 10 to 15 days.
Okay, sir. So almost 10 to 15 days it takes if it is a perianal abscess.
Not always, depend on the
Hmm.
size of the abscess and depend on the, as soon as the patient comes, it is
Hmm.
smaller and it will take less time.
So always is it IND or incision and drainage the only option, or with medication also in the early stages it can get cured?
Sometimes if the patient comes in very early stage, the
Hmm.
infection may get cured, but in later stages it is only the IND
Okay, sir. That
which
will help.
that will help.
Okay, sir. What happens if the treatment is delayed or it is avoided?
Ma'am, if the treatment is delayed, abscess will convert into fistula in NO,
Okay.
and one disease may lead to another disease, as we say, so it will lead into fistula in NO.
Okay, sir. So what if once it is treated, are there chances of recurrence?
Ma'am, if it is completely treated and there is no fistula in NO, then there are less chances of recurrence until unless a new gland get infected and a
Okay,
new
sir.
abscess forms. That is another case. But
Hmm.
if this abscess is treated properly, follow-up dressing is done properly, then there are less chances of
Any
recurrence.
advices like to prevent the recurrence of perianal abscess?
Yes, ma'am. One should take hot bath twice daily, and he should have a good hygiene of that area after passing stool. And if the patient is diabetic, if it is obese, then he should reduce his weight. Then he should have a good control over his diabetes. He should control his blood sugar levels. Then he has less chances of recurrence, and he can get treated very early.
Okay, sir. So what will be the take home message from today's episode for our audience, for our UGPG students? What it would be?
Ma'am, as in the previous discussion, I have told that the fluctuation is very late sign in this perianal abscess. So, if there is perianal abscess, if you have pain in the perianal region, if you have fever with chills and rigors, or rather only pain, then also you should consult anorectal surgeon as soon as possible. Because if you will wait for the fluctuation test to develop, then it is very late, and the abscess has already damaged most of the tissues around the anal canal, and it is very late, so it is difficult to treat, and already there are loss of tissues.
Okay, sir. So thank you, sir, for providing all that elaborative information on perianal abscess. And I'm sure people will now take it seriously. Even the back problems are important. More in the upcoming series of Varta. More Varta in the next episode. See you all till then. Swasth rahe, mast rahe, vyast rahe. Dhanyavad.
Thank you all.